Now, Republicans in the Senate have been working on the new version of Trump Care that, of course, they're starting to roll out. In fact, today, they actually let people know about what they've been working on. They've actually released a version. Now, the House version of Trump Care was, as you know, an awful piece of legislation. According to CBO, it kicked 23 million people off of their health insurance, raised premiums for older and sicker people, rolled back the Medicaid expansion for the poorest Americans, and of course would allow states to opt out of protecting coverage for people with pre-existing conditions. So again, there's a lot of terrible things in that. Not a very good bill. So, and of course, because of that, it's not very popular with the voters. So the Senate version, now that that's out, is it any better? Well, let's take a look. According to the Washington Post, Senate leaders on Wednesday have been putting the final touches on legislation that would reshape a big piece of the U.S. healthcare system by rolling back Medicaid while easing the impact on Americans who stand to lose coverage under the new bill. The bill largely mirrors the House measure that narrowly passed last month, but was some significant changes aimed at pleasing some of the moderates. Now, remember, Trump Care was originally stopped in the House by the Freedom Caucus, the original Trump Care 1.0, right? Now, they stopped it because the first version to them wasn't conservative enough. And, of course, they couldn't get the so-called moderates on board. So they're pretty much stuck. They couldn't even bring it to a vote. Now, again, the Freedom Caucus thought it didn't punch poor people in the face enough. So they wouldn't vote for it. On the other side, some of the moderates said, well, that's not... That punches people in the face too much. We're going to get killed in 2018 at the polls. So with that in mind, of course, the Senate decided when they took up the new House version to make a few significant changes. Here are the details. As a nod to conservatives, the Senate bill would give states more leeway in opting out of the ACA's insurance regulations through expanding the use of so-called 1332 waivers already embedded within the law. According to the draft proposal, states could use the waivers to make federal subsidies available even off the marketplaces, but they couldn't go as far as to lift ACA protections for patients with pre-existing conditions. So here's what we have is more waivers, okay? Meaning that if you live in a red state, you'll be less protected. Oh, wonderful. Now that, of course, gets the Freedom Caucus on board, or is meant to. As for what's to appeal to the so-called moderates, Senate leaders are hoping the big draw for them lies in the bill's more generous income-based approach to insurance subsidies, which closely mirror the subsidies offered under Obamacare. Now, that's important. That's actually a big distinction, a big change, because they used to base the subsidies off age. So people who are older would actually get a more generous subsidy. People who are younger did not. So, because they would consider them more healthy. Now, if you are somebody with pre-existing condition who's younger, well, you're screwed. So, okay. Now, as far as the subsidies go right now, subsidies are available to Americans earning between 100% and 400% of the federal poverty level. Now, under the new bill, starting in 2020, the assistance would be capped for those earning up to 350%. So there's a cut right there. But anyone below that line could still get the subsidies if they're not eligible for Medicaid, for as long as Medicaid actually exists. Now, the subsidies would also mirror ACA in that they would be pegged to a benchmark insurance plan each year, therefore ensuring the assistance grows enough to keep coverage affordable for customers. So again, they're taking parts of the ACA and going, all right, well, we're going to put this in our bill since it seems to be fairly popular. Now, the Senate bill would also keep the ACA's Medicaid expansion around for a little longer, gradually phasing it out over the next 3 years, starting in 2021. So after 2021, no more Medicaid expansion, you're done. So if you're poor, you're essentially screwed. Now, you still have the subsidies, but they're actually far less generous. So instead of punching poor people in the face, they're at least giving you more time to prepare for that punch in the face. Wonderful. Now, despite these shifts, moderates, the New York Times reports, the Washington Post reports, are likely to be turned off by how the bill cuts Medicaid more deeply than the House version. But the biggest cuts wouldn't take effect for 7 years, a time frame that could be more politically palatable for so-called moderate members like Rob Portman and Shelley Moore Capito. So it's like, well, and we're going to make huge cuts to Medicaid, but don't worry. They're not going to, like, by the time they phase in, you'll forget that we did it. And we'll have served another term. Well, it works out great for us, not so good for you. Wonderful. Now, under the Senate draft, federal Medicaid spending would remain as it is for 3 years. Then in 2021, it would be transformed from an open-ended entitlement system based on per capita enrollment. Starting in 2025, the measure would tie federal spending on the program to an even slower growth index, which in turn could prompt states to reduce the size of their Medicaid programs. Basically, that means tightening requirements and kicking people off Medicaid, who aren't the poorest of the poor. So that's another effect that this is happening, that this will be having on regular people. So now, the bill also includes cuts to, not just includes cuts, it completely defunds Planned Parenthood. And it ends the insurance mandate. Now, that's also important when we get into the next part. After this, the Senate bill would also provide funding in 2018 and 2019 for extra Obamacare subsidies to insurers to cover the cost-sharing discounts they're required to give the lowest-income patients. Insurers have been deeply concerned over whether the subsidies will continue, as the Trump administration has refused to say whether it will keep funding them in the long run. So, hey, man, we got to keep funding those insurance companies, right? So let's go to the reason that they're actually trying to continue to push this bill. And it's the same reason all along. The draft also proposes repealing all of the ACA taxes except for the so-called Cadillac tax on high-cost health plans in language similar to the House version. Now notice that's, of course, one thing that's been very consistent across all the drafts of Trump Care, the getting rid of these taxes, okay? They desperately want to cut those taxes for them and their rich friends because that is who they serve. It's basically something that's always going to stay the same. Now, those taxes on the ACA, they're actually fairly progressive. The higher earners pay more to subsidize the poor and the middle class, people who get subsidies, right? It's a redistribution of wealth from the top to the bottom. Now, the Republicans, they hate that. They think the rich shouldn't have to pay for anything. But look, if you end up cutting all these taxes and eliminating the individual mandate, which I understand is super unpopular, then the program, all the stuff that's still in it, we wouldn't be able to pay for. Now, that means first more cuts, and then the gradual elimination of the entire program. See, the Republicans, you got to give them credit. They actually see the long game in this. They want to eliminate the ACA, and they can't do it right away because, again, if you try to get rid of it right away, fully and everything that's popular in it, well then, obviously, there's a lot of people that are going to be very, very angry. But if you do it this way, if you make sure you cut all the taxes so that you can't pay for the program and eliminate the individual mandate, which also helps pay for the program, and the thing collapses in on itself or starts to, or Republicans later on will just go, see, it's failing. So here's what we're going to do. We're just going to cut all this stuff. And we'll go back to the way it was, the bad old days. So it's actually even worse than the Trump Care bill, which is bad enough on its own. What, you think the Republicans wouldn't do that? You think they're not chomping at the bit to cut subsidies for poor people? They hate poor people. And look, yeah, if they don't raise taxes to pay for the subsidies, they're going to go into debt. They're going to talk about the debt. They're going to scream bloody murder, and they're going to get rid of those subsidies. You know it. They're essentially defunding everything right now to justify gutting it more even later in order to save their rich donors millions and millions of dollars in taxes and to do their social Darwinism. That's what repeal and replace has always been about. Now, I hope the so-called moderate Republicans, who are really just still very right-wing, but just not as bad as the extreme Republicans over in the Freedom Caucus, fear so much for their seats in 2018 that they cannot come to an agreement with the Freedom Caucus, right? I don't know if that's going to happen. maybe if they do it right by delaying some of these changes, and it looks like that's what they're trying to do, and trying to keep the bill more quiet until 2018, we might end up seeing a vote get through Congress. I don't know. But I think it really hinges on people not paying attention. Now, thankfully, I don't think it's going to happen. So I want you guys to understand that right now, the public pressure on our politicians has actually been very effective at pushing at these moderate Republicans to not take these bad deals. So my advice is keep fighting the bill. What we're doing is actually working. And for a long-term plan, let's start, I don't know, supporting progressive candidates in upcoming primaries in 2018. That's coming fairly soon. So if progressives start winning in these primaries, well, then we can actually start taking the fight to Republicans and defeating them so they don't pass these awful pieces of legislation. Imagine no more weak John Ossoffs, milquetoast like Democrats. We actually need strong progressives with a bold vision who aren't afraid to wreck the Republicans, especially over pieces of crappy legislation like this. And whether they get it passed or whether they don't, Democrats need to use this bill as a cudgel. And not only that, but present a progressive alternative to it, like single payer, or at the very least a public option. Did you know that Medicare for All, single payer, has an over 60% approval rating with the general public? And it's huge among Democrats. Trump Care, depending on the one poll or whatever poll that you use, some polls have it 15%, 17%, others have it around 30%. You look at that, and you look at the two plans, and you realize that one of them is slam dunk, and that's single payer. Now, if the Democrats decide they don't want to run on that, which a lot of them aren't, well, don't worry, progressives will. And when we do that, then we'll bring it to the public and let them decide what they'd rather see. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.